This is a lecture on tricyclic antidepressants. Now, tricyclic antidepressants are named because they have a three-ring structure, just like a tricycle has three wheels. So we're going to try to focus on three aspects of tricyclic antidepressant overdose that are relevant to clinical practice. There are three major ways in which TCAs affect the body. The first is the central nervous system. The second is the cardiovascular system. And the third is its action as an anticholinergic. Mad as a hatter, blind as a bat, dry as a bone, hot as hell, red as a beet, and tacky as a leisure suit. Regarding the central nervous system, TCAs tend to cause sedation and in an extreme coma. They can also cause seizures. We've already briefly reviewed the anticholinergic syndrome, but do note that because of its action on the central nervous system, you can have a patient who is both sedated and delirious. There are other combinations as well, so this can complicate the picture. Lastly, we'll discuss TCA's toxicity on the cardiovascular system, as seen on the EKG. This is heavily tested on boards as well as clinically relevant. We also make several therapeutic decisions based on some findings here. The most important effect TCAs have on cardiac conduction is a widening of the QRS complex. When you see a wide QRS complex in the setting of toxicity, you have to be worried about TCAs. Ultimately, what you need to remember is this needs bicarb. You also get right axis deviation, particularly of the terminal R wave in lead AVR. Lots of R's here. Here in lead AVR, you can see that large terminal R, demonstrating right axis deviation. There's also a large R to S ratio. In sum, TCAs make a bad overdose. They can affect the central nervous system by causing sedation, coma, and seizures. They can cause an anticholinergic syndrome, and they can affect the heart, particularly conduction, as evidenced by a widened QRS and a large R wave in AVR. Any findings on the EKG, particularly widened QRS, demand treatment with bicarb.